Understanding Genograms for Kids' Mental Wellness Therapy. Imagine a picture that shows not just your family members but also how they feel, how they connect, and how their stories might influence a child's emotions. That's what a genogram does. It's like a family map that goes beyond names and dates. It shows relationships, feelings, and patterns that run through generations. In kids' mental wellness therapy, genograms are a helpful tool for understanding what might be affecting a child's feelings and behavior. They help reveal if there are repeated issues like anxiety, depression, or trauma in the family history. When these patterns are visible, therapists and families can see what might be causing a child's emotional struggles. This makes it easier to focus on solutions rather than just symptoms. A genogram helps explain why a child might react a certain way. For example, if a child often feels anxious, the genogram might show a history of unresolved trauma or emotional neglect in the family. Knowing this helps therapists suggest specific strategies to help the child manage those feelings better. It also helps families understand their child's reactions and support them more effectively. Genograms also show family roles and how family members communicate. Some families have roles like the caretaker, the scapegoat, or the enabler. These roles can influence how children express their emotions and cope with stress. Recognizing these roles helps therapists guide families toward healthier ways of interacting, which supports a child's emotional growth and resilience. Using genograms in therapy encourages better communication among family members. When everyone can see their family's emotional history laid out visually, it becomes easier to talk about feelings and boundaries. This can reduce misunderstandings and help families build stronger, more supportive relationships. These relationships are key to a child's mental health and emotional stability. Therapists also use genograms to create personalized treatment plans. By identifying risk factors like emotional neglect or trauma and protective factors like supportive relatives, they can develop targeted strategies. For example, therapy might focus on building a child's self-esteem, improving attachment, or breaking unhealthy family cycles. Families are often involved in creating and reviewing the genogram. This active participation helps them see their strengths and challenges clearly. It also encourages them to take part in their child's healing process. When families understand their emotional history, they can work together to support their child's mental wellness more effectively. In summary, genograms are a simple yet powerful way to understand how family history influences a child's emotional health. They reveal patterns and roles that shape feelings and behaviors. This understanding helps improve family communication, guides therapy, and builds resilience in children. It's a tool that brings families closer and helps children feel more supported and understood.